So hello and welcome everybody to this month's team brief. We're taking some videos and recording what's happened today for those of you who couldn't get away from your work areas, but so that you can keep up to date with what we've discussed. This lunchtime's agenda started with an update on the General Trust position from myself. Then Lorraine Knight, our Interim Chief Operating Officer, talked to colleagues in the room about the learning from a root cause analysis that's been done in relation to what happened to us last winter, how busy we were, the major incident that we had in January. And then there was a workshop discussion around, well, what does that learning help us do in terms of planning for the winter that's coming? And finally, we had Dr. Bartek Svetch and Dr. Graham Hartman, who have put together a proposal for a positive day, and they've come to brief colleagues on what that's all about and what help they need with that. When I gave the brief update of the Trust, I covered the 4 areas of the strategic objectives, starting with best outcomes. And I talked about a number of things, but importantly to share with you that we've had some fabulous results from the National Laparotomy Audit, and we've taken the step to join a local emergency laparotomy collaborative that's being led by Dr. Mick Imrie and Dr. Jonathan Trickett. So if you want to get involved in that work, make contact with them. I also urged everybody just to check where you are as a team with your CQC action planning, and to remind you that we do have to submit an action plan to the CQC following the visit before Christmas. And although it's gone off people's agendas, I suspect because we've done well, we must really pay attention to doing that. So please take time to review where you are with your CQC action plan. We then moved on to patient experience, and I just highlighted 1 or 2 things that have been going on, such as the Patients as People exhibition, and we also talked a little bit about performance in our accident emergency department, our referral to treatment time performance, and our cancer target performance. Now, generally, we're not doing too badly and lots of great work has been done, but as ever in the NHS, we've got to keep going. We need more successful days in the A&E department, and I suppose the key message from that is to remember that it's not about just the team in A&E, it's all of us. We've all got a role to play there. So please be mindful of the work that we're doing right across the hospital to support those patients. And finally, I gave an update on trust finances and our position in relation to efficiency and productivity. And overall, the message is good there. People are working very hard on their cost improvement programs. We're working very hard to meet the demand of the hospital. And generally, in relation to our financial position, we're in a good place. But lots more to do. We've got to keep up the good work. And just to thank you from me for all that you're doing.
Hi, good afternoon. My name's Dr. Graham Hartman, and I have come to Team Brief today to talk about Posi Day. This is a new and exciting, innovative event that we are planning, where we basically want to try and tackle a negative atmosphere at work. We want to try and bring everyone together, make it more positive, and there's lots of fun prizes to win as well. The way it works is everyone is invited to take part, and after registration you'll be given 5 Posi tokens, and at any point during the day, if you see someone that's done something positive or gone above and beyond in their duties, you give them a token. Person with the most tokens at the end wins. It's as simple as that. And the idea is, like I say, just to create some positivity and a nice friendly atmosphere at work.
Hi, I'm Lorraine Knight. I'm the Interim Chief Operating Officer, and I've presented today at Team Brief on winter planning. And we started by looking at the run-up of events in 14-15 that led to us having to call a major incident in the organisation. We also took a look at what was happening in July of this year and the similarity to what we were going through at this time in 2014. I spoke a bit about the system-wide piece of work looking at the root causes of the major incident and how we learned from each other through that event, and how we were exposed to the root causes of each of the component organisations that manage healthcare across North West Surrey sector. We then asked the teams to think about what they did last year that worked really well in terms of winter planning, and what we could do different this year to make sure that we were more resilient and could cope with the peaks and troughs in demand. So the feedback from the session was mainly around how we manage our staffing resource and having the right people with the right skills in place at the right time, and how we might make our annual leave planning more robust. So that did not mean that we were going to ban all annual leave, as was the belief in some areas, but look creatively about how we might make best use of our staffing. We heard examples in estates and facilities and hotel services about how they multi-skill staff to work across different areas, between housekeeping and portering, for example. We also heard about the need to get extra engineering resource in to be able to fix beds quickly and not have to wait on an external contractor to come in. And we also had feedback on how we manage our elective patients that are coming in through theatres at that time of year, and whether we should stop elective operating in the run-up to the Christmas and New Year period and then start in the new year.